Thank you for watching another video on money mechanics. Please like, subscribe, and comment. Also, nothing in these videos is to be considered financial advice. If you need financial advice, please consult an appropriate professional. I do these videos for educational purposes only, and maybe a little bit of entertainment. I wanted to talk a little bit about today, talk a little bit about Medicare. Medicare is our single-payer nationalized healthcare insurance here in the United States. And it's for those who are 65 and older, and also for those who have been on Social Security Disability Insurance, SSDI, for 2 years or more. And there are a couple other categories of people that can get Medicare, but those are the two big ones. The biggest is those 65 and older. 4 parts to Medicare. 1, 2, 3, 4. And there are 2 different ways that you can get Medicare delivered. So let's go over those. Part A, Part B, Part C, Part D. So Part A is hospital insurance, and that is through the federal government. Part B, as in boy, is doctor insurance, and that is through the federal government. Part A and Part B are what's called original or traditional Medicare. Back when it was first passed, that's all there was. Since then, though, there have been some things that have been passed and added on to it. Part C of Medicare, as in CAT, is that's Medicare Advantage. And most of the time, you're going to get Medicare Advantage through a PPO or an HMO. And you do have to have Part A and Part B of Medicare to get Medicare Advantage. Also, Part D, as in dog, is the prescription drug plan part of Medicare. And this is something that you can buy if you are on original Medicare. So, it's a little hard out here to concentrate because people are riding their bikes and driving and staring at you as you're talking, so I do apologize. Part D is the prescription drug benefit, and that is through private companies, as is Medicare Advantage. So Medicare A and B are through the government. Part C and Part D are through private companies. And normally you would get a prescription drug plan as a standalone plan with original Medicare, or you can get it as part of a Medicare Advantage plan, or as I said, Part C. There's also kind of it's not really a part of Medicare, but it's something that goes along with it, and that is Medicare supplements or Medigap. And that is when you have original Medicare through A and B through the federal government, and then that doesn't pay for everything. So that's why they call it Medigap. It covers the gaps in Medicare, and there are different plans, different supplement plans you can get, and they all go by a letter. So those are kind of the parts of Medicare, A, B, C, D, and then, supplements go along. You can get one of those if you have original or traditional Medicare. Then there are 2 different ways to get Medicare. You can either get it through the federal government, Part A and Part B, where the government insures you first. And you can just have that with a prescription drug plan. What most people do, if they can afford it, is they have Part A and Part B through the federal government, they have a supplement, and then they have a prescription drug plan. Or you can get a Medicare Advantage plan, Part C, and normally that's going to cover your A, your B, and your Part D normally. I mean, sometimes it doesn't cover the drugs, but it almost always does. Anyway, that's kind of Medicare in a nutshell. Either original Medicare through the federal government, or you get your Medicare through a Medicare Advantage plan. And then the 4 parts plus supplements. This is a very bird's eye view of Medicare. It's very complex. There are a lot of decisions that have to be made when you do what's called aging in, and that's normally at age 65. Or you could come in later if you're still working. But there are all kinds of decisions that have to be made. For example, if you want to get a supplement, most times you can only get a guaranteed, what's called guaranteed issue, where they cannot deny you for a supplement the first 6 months you're on Part B, as in boy. And a lot of people don't know that, and they think they can just switch back and forth from a supplement to Medicare Advantage, and it's really not that easy. And then the open enrollment or annual enrollment period from October 15th through December 7th of what we're in right now, that's for Medicare Advantage and prescription drug plans to switch those. I hope this video has been helpful. I'd appreciate your comments and your likes. Thank you for supporting the channel. God bless. I'll see you in the next video.